And we are entering 2022 in a place none of us wanted to be, plagued by the most contagious COVID variant of the pandemic. Cases, the highest they've been in the entirety of this thing. Testing supplies unable to meet demand. But we are entering this year with more tools than ever before between vaccines, boosters, antiviral pills, and more. So joining me now once again on the Pigside Morning News is Dr. Anthony Fauci. So Dr. Fauci, thank you so much for coming back. Good to see you and Happy New Year.
Thank you. Same to you. Thank you for having me.
Of course. So, Dr. Fauci, let me begin right now with the sobering reality, right, of these case numbers. New York reported more than 62,000 new cases yesterday. New Jersey reporting nearly 25,000 new cases. You've said that things could potentially get worse. What is worse? And when do we reach the peak of Omicron?
Well, worse is what we're going to be seeing over the next couple of weeks, because continually we're seeing, and it was in many respects predictable based on what we've seen in South Africa and in the UK, that you have almost a vertical spike of the cases going up. They're not going up gradually, they're going straight up. You know, we're now averaging about close to 400,000 cases per day. It is going to go higher than that. I can't give you an exact number, but It will continue to go up at least a few 100,000 per day more. What we hope will happen is what we've seen in South Africa, and that is you reach a point where you peak and turn around and the cases come down rather quickly. So we've got to do our very best over the next few weeks and even beyond to abide by the public health principles. And that means, obviously, if you are not vaccinated, you know, almost pleading, please get vaccinated. Yeah. That's the most vulnerable group. And if you are vaccinated, get boosted, because we know now that the boosters reconstitute that diminished immune protection that you get.
Right.
And all the other things we've spoken about making sure you avoid crowded places, wear a mask in all indoor settings when you don't know the vaccination status of people. Those are the things that we can do.
Right. So if you're saying there's a few 100,000 more cases that could be on the way, right? Let me talk about this. The CDC came out with these new quarantine guidelines, reducing quarantine from 10 days to 5 days, which obviously caused some confusion among doctors, and mainly the public. Can you help us understand the rationale, I guess, behind the decision? Is this a shift to learning to live with this virus?
Well, it really is, and you know, the CDC is a very difficult position. They're abiding by public health principles, but they realize that you have a situation where if you have such a high percentage of people who are out because they're infected or exposed, even though the infected people might be asymptomatic, if you look at the numbers of people that would be out of action, particularly those with critical jobs, I know in New York City, a really substantial proportion of the population of firefighters and of police are out because they were either infected or exposed. So you've got to make sure that society remains functional for the health of society, and you try and strike a balance of protecting people from being infected, but yet allowing people to return sooner, namely after 5 days as opposed to 10 days.
And that brings me to this, right?
Provided they are without symptoms.
Without symptoms. And then yesterday you said that the CDC may recommend this negative test, right? Why not just recommend that to clear up the confusion right now? And should this have been something that was really in this initial plan?
Right. Well, that's what we're going to do. We're going to wait for the CDC to come out with some clarification about that, because you're right. There was a bit of a confusion. Hopefully that will be clarified soon.
Okay. And Dr. Fauci, we hear this term herd immunity. You and I have talked about this almost every time that you've been on our show. And I'm curious, can we reach this herd immunity in a different way? If the majority of the public contracts Omicron, could that move us closer to an end of a pandemic?
Well, yeah, there are two aspects that go into that. I think if you combine people who have been exposed, infected, and recovered, will certainly have a degree of protective immunity. It might lessen with different variants, but there will be some degree there. And you superimpose that upon people who've been vaccinated and boosted, we would hope there'd be enough background protection at a population level that when you do get new variants, you won't have these massive spikes and surges that it will reach the point that you're referring to. You know, herd immunity gets confusing when you use it as a terminology.
Right.
What we're saying is there's enough underlying and background protection in the community that it no longer disrupts our lives, our function, our economy, our ability to go about our lives without being dominated by the thought of this virus.
Yeah.
That's what we mean by getting it to a level that's low enough that we can move on with our lives.
Yeah, and I think everybody wants to move on with their lives, right? But as we talk about the tools to fight, and you've brought up the vaccines and mask wearing, is it time to change the term of what fully vaccinated means? And should that include boosters at this point where there are these mandatory vaccine mandates?
Yeah. You know, one of the situations is that it's almost semantics. I have been saying loud and clear, if you want to be optimally protected, you need to be boosted. Whether or not this definition for purposes that are related to requirements for different returning to work or going to school or et cetera, in some respects, that's not really the relevant scientific issue. The relevant scientific issue is that it is overwhelmingly clear that in the current status where we are right now, vaccinated people should get boosted if they want optimal protection.
Good. And I think, you know, it can't be said enough. That's why I ask you to repeat it over and over again. But we did ask our viewers, Dr. Fauci, to send in some questions. A number of them did ask this one. And by a number, I mean over a dozen, saying, I just got COVID. I did not have my booster. How long do I have to wait until I get a booster?
Yeah, that's a good question. There's no definitive time, but it should be anywhere, I would imagine, between 30 days and 90 days. You don't want to get boosted right away because you're still having your immune system mature in its response to the original infection. That's the point. Or the original vaccination. But if you're talking about, I'm vaccinated now, when can I get boosted? The recommendations are clear. 6 months if it's an mRNA, and 2 months if you got a J&J. Those are people who've been vaccinated and want to know a boost. There's a very similar question that is not a booster question, but a vaccination question.
Right.
It's if I got infected and I want to now get vaccinated, how long do I have to wait? And that's the one where it ranges anywhere from 30 to 90 days.
Okay, another popular question, because we're almost out of time here. How many times can a person contract COVID even after a booster, and how quickly between positive diagnoses? I think people who had COVID in the past are worried they're now going to catch Omicron if they had it in the past.
Well, the experience that we are hearing very clearly from our South African colleagues is that people who were infected with either Delta or Beta are getting reinfected, although at a very low level of symptoms, with Omicron. I don't know, there is no time frame, like if I got infected a month ago, when can I get reinfected? It is very unlikely that if you were infected with Delta, that 3 weeks later you're going to get infected with Omicron, because it's very likely that your immune system is strong enough in its response, at least for a few months, you'll be protected against reinfection.
Good. And today, I want to pivot to children for a second, because it's the first day back for so many kids in classrooms, right? Everyone agrees that kids need to be in classrooms to succeed. But there has been this headline, Dr. Fauci, about a rise in pediatric infections. So how is the new variant affecting kids, and is it more or less contagious among little ones as the previous variants?
Well, we know one thing for sure, that Omicron is substantially more transmissible than Delta. Children were getting infected with Delta. The fact that Omicron is substantially more transmissible, without a doubt, more children are going to be infected with Omicron, merely because of the nature of the virus being more transmissible. No doubt about that. And more children that were going to get infected, you're going to see more children being hospitalized, even though the likelihood of getting hospitalized for a child is considerably less than for an adult. Nonetheless, when you get so many children infected because of the high degree of transmissibility of the virus, you're going to see more hospitalizations. And that's exactly what we are seeing.
Is there a timeline, Dr. Fauci? I know it's tough with the timelines. For those under 5, a lot of parents were asking.
Yeah, that's going to be sometime in the first quarter of 2022. Hopefully earlier in the quarter than later. But certainly there needs to be more studies done in the children from 6 months to 4 to 5 years.
You know, and I've heard you discuss these mandates and possible mandates to come. Should there be more mandates on the table for things like flying or even in to enter an establishment? In New York, you have to show it. In New Jersey, you do not. What are your thoughts here?
You know, if I give you my thoughts, it's going to get taken completely out of context, as many things are. We need to get people vaccinated. That is critical. We have a highly effective and safe group of vaccines.
But can't a mandate do that?
Well, mandates work. We know that. We know that when companies, large companies like airlines, large companies like Tyson's Food, large groups, when they do mandates, they work. You get over 90+% of people complying with the mandate. You don't like to mandate people to do things, but sometimes you have to sacrifice people's individual feeling of somebody telling them what they need to do when you have the communal and public health of the entire nation at stake.
So shouldn't there be one to fly? I mean, on a plane, people are taking their masks down saying, well, I need an hour to eat my peanuts.
Now, well, again, those things are, I've said it again and again. Yeah. Sometimes it's taken out of what I say, and sometimes it's taken out of context. So let me say it clearly.
Please.
It is discussed, it's on the table, but no decision has been made about that.
All right. And Dr. Fauci, lastly, before I let you go, because we appreciate you here in New York, what is one piece of promising news in 2022 that we can take with us into this new year?
Well, the promising news is that we have the tools to do something about this. And if people comply by the recommendations, we will get out of it sooner rather than later. And you know what I'm talking about.
Yeah.
If you're vaccinated, get boosted. If you're not vaccinated, get vaccinated and wear a mask in indoor congregate settings. Avoid large, crowded indoor places. And we will get through this much better than if we don't abide by those public health recommendations.
Dr. Anthony Fauci, New York's very own. Come back to New York soon, okay?
Thank you. Thank you. Appreciate it.
All right. Good to